And a lot of the reasons that these studies are being done are to treat, as you noted, certain mental health issues, whether it's drug-resistant depression or trauma. And as you noted, there's a vast majority of patient population that suffers from depression. And then you also have a group of those patients who are referred to as drug resistant. So they've been taking these chemical compounds um, sometimes for years, never really getting any better, switching different cocktails of compounds and different chemicals and still never really getting better, and doing that alongside therapy. And so, like you said, from some of the indications here, early indications are that by using psilocybin, for example, that some patients are seeing dramatic results from that.
What I could really say is I think in this space, really the trials were addressing some of the most difficult to treat patients, essentially by definition. As you say, Deborah, they've been treatment resistant to the standard approaches. Those are, for the most part, antidepressant drugs, but we should also say, in fact, that in the psychotherapy space as well, many of the patients have not been able to fully recover from their depressions through, be it psychological means, cognitive behavior therapy, and other approaches, interpersonal psychotherapy and others, as well as the antidepressants. So really, this has been a difficult to treat group. And in this space, the researchers and the clinicians have really actually adopted to start there, to start with the most difficult patients. Deborah, what you do say, though, is you have discussed both depression and, on the other hand, trauma. And these really are potentially different groups. One can become depressed as a result of traumatic life events, but one can also become depressed through other means. What I would emphasize at this point is that the trials that have been conducted for psilocybin have been with the group of depression and not necessarily yet have addressed the trauma group. But I think actually some of the trials that are being proposed, supported in part by medicine, include some new proposals to actually address persons with significant trauma, be it veterans with PTSD and other groups. And that is just so wonderful to see. We really need especially novel treatments for this group. When we look at depression, we do have people with, quote, treatment-resistant depression. They have not gotten better through the typical approaches. But in trauma, I would say trauma is really difficult to treat as a norm. These are not a subset of the groups. This is rather people with trauma are often very difficult to treat. And so this approach to develop novel interventions for that group is just so needed, and I'm so grateful to be a part of this, that indeed Minison and others are looking to try and provide some support to persons with significant trauma in their lives, helping them recover.